Good day, everyone. In this video, we are going to continue the discussion on inspection. The first one is breathing. We're going to observe the breathing in terms of the rhythm, such as the pattern, the times, intensity, the rhythm. These information you're also going to learn from the general medicine diagnostics. So we're not going to focus on here a lot. The other reason is also because if patient presents with these abnormal, most of these abnormal we don't treat with acupuncture. So as long as you know that's abnormal, then you will know where to refer to. So we don't focus on here. And also the normal breathing pattern or the normal breathing is 18 to 20 times per minute. Or what you need to remember in the breathing. The pattern changes, the time changes, intensity changes can indicate some other information, some other medical conditions. The abnormal of the abdomen, we focus on some of the shapes. The first one, bulging. The bulging refers to in a supine lying position. The anterior abdominal wall is noticeable higher than the line connecting the sternum and the midpoint of the symphysis pubis. So this is the bulging. As you can see in the supine lying position, or even this patient in standing or sitting position, you can see the abdomen protruding, the bulging. So this is the situation we talk about. This kind of problem, the patient may present with like obesity patient, or you also can present with this patient with edema or qi stagnation in the stomach. So as you can see until now, when we use the theories to explain the manifestations, if the patient presents in certain area of the body that's abnormal or become bigger, enlargement, we will think about what's in there. It can be the qi, that stagnation. It can be the blood stasis. It also can be phlegm, can be the water retention. So that's how we see from this bulging, and we think what's inside. And that's how to treat the root cause. The next one is abdominal retraction. The abdominal retraction also in lying position. You can see the patient, the abdomen is lower than the line when you draw in from the sternum to the pubis. And this can present in a patient with insufficiency or in the stomach and spleen and stomach deficiency, qi and blood deficiency. So this patient don't have enough nutrition. Also, the patient may present as vomiting or diarrhea, excess vomiting or diarrhea. That's why become skinny. If you see a patient present with bulging abdomen like this, as well as you see the veins on the wall of the abdomen, you need to be careful. This is the chronic water retention in the abdomen, and the veins when we see here. What do you think? How do you explain the veins here? When we see the clinical manifestations, we need to think about how we explain with our theories. So firstly, this patient got bulging abdomen. From physical examination, we can find out that the patient got water retention in the abdomen. And now you see the veins. What's the color of the veins? It's bluish or cyan, right? That's in the facial complexion. We talk about the color. The bluish or cyan color refers to reflects the stagnation. So for this kind of problem, you will think that the stagnation, the patient presents with water retention in the abdomen. The water retention can due to qi stagnation or blastasis. How do you know blastasis? That's from the bluish veins here. The bluish, the color can reflect the blastasis. And this is also in Western medicine, in general medicine, you also need to know that this condition is quite severe. The patient may suffer from liver problem, the physical liver. So in the general medicine, the patient may have the liver problem. Protrusion of the abdominal walls or hernia. This is just the abnormal. This hernia can happen in patient with edema in the abdomen, or such as these two. The patients don't have edema, but the protrusion of these. For these, also no acupuncture can help. But how do we understand the dislocation of the certain organs, such as for this one, especially for this one, for this one on the right side, if it is the intestine goes out from the baby bottom. How do we understand from our theories? That's the dislocation of internal organs. That's from the deficiency of the qi defining function. The qi confining function. So the qi is supposed to hold the internal organs in certain position, but now why the organs comes out? That's because the qi doesn't have enough force to hold the organs to certain position. So that's how, if we use herbal medicine or acupuncture to treat hernia, that's how we understand from the theories. We're going to we're going to tonify the qi in the body. That's how we can help the hernia. The inspection of the back and lower back or waist, we more focus on the shape or the appearance of the back. And also when we talk about the back or the lower back, we need to understand that the back is the dimension of the chest. The chest is where the lung and the heart sit. So when we talk about the lung and heart, don't always think about the front chest. It's also the back, also part of the dimension or part of the area, the location where the lung and the heart sit. The waist. The waist is the very important for our movements, and also the waist is linked to the kidney. That's why in the theory we says that the waist or the low back is the dimension of the kidney. So when we see from the abnormal from this area, sometimes can reflect the internal organs, especially from the kidney. But mostly you will see some of the abnormal changes here. You will see that some are genetic. The first one, the spinal curvature. As you can see, these two. These problems we can use our theories to explain because the changes is the position of the bones changes, but we don't focus on here. The reason is because this, we also don't use acupuncture to help. Acupuncture could not help this situation. Spinal malnutrition, the emaciation and muscle wasting of the spine. So that's the weakness of the spine, impaired toning of the low back. These parts, the abnormal movements, is something we can help. Patient may experience with lower back pain and problems in toning. The reason this is very similar to the neck stiffness. The patient have problem moving impaired the moving function of the neck. Now it's the lower back. It can be from the injury. It also can be the blood stasis. It can be the coldness affect the lower back. The coldness affects the meridian and cause the meridian blockage in the lower back. On the observation of the back, especially when we talk about skin, we're also going to mention some of the other diseases can happen in the back. The lower back and leg pain. The lower back pain radiates to lower limbs and impairs the movement aggravated by bowel movements or cough. This can be internal stagnation blood, cold dampness, malnourishment of the lower back due to deficiency of liver and kidney. Why we said kidney is because the lower back is the mansion of the kidney. The liver and kidney have the same source. That's why they're always together. So that's how we understand these manifestations. And when you see these manifestations, you need to think about these causes can result in the blockage of the meridian. So in the study of the diagnostics, you need to identify what's abnormal, what's abnormal changes when you observe. Also, you need to explain with the theories what's the cause, what's the results, why the patient will have lower back pain and leg pain. So that's the explanation. Some other explanations you can find from the textbooks. The textbooks also an examples of explanation. Inspection of the four limbs. The limbs are related to all脏腑organs, meridians. The reason is because the limbs, extremities, include the skin, the body hair, blood vessels, sinews, bones, muscles, and forelimbs. And the observation, we're going to focus on the shape and movement. So as you can see from this session, these two videos, the observation will be more focused on the shape and movement, just different area. First one, atrophy. Atrophy, you can see the patient's leg much smaller than normal. And this patient cannot walk well. This is the qi and blood deficiency cause the malnourishment of the meridian, especially in the legs. The edema you can see from the right picture, you can see very obvious. But how do you know the edema? How do you examine the edema? You're going to use your finger to press. So the pitches after you press, this can reflect the patient caused edema. The edema is the water retention in the legs for the treatment of this edema, how do we treat the water retention? So from here, you also don't think about the water retention, so you're going to increase the diuresis only. You need to think about in Chinese medicine theories. We have studied before which aspects are linked to the water metabolism, the lung, the spleen, the kidney. That's how we treat edema, either through acupuncture or herbal medicine. So don't only focus on the bladder function to increase the kidney, the to increase the urine or increase the urination. Knee swelling. Knee swelling. This patient can present with knee pain. And this mostly happens in the inflammation of the bones or arthritis. The reason, how, how do we explain this phenomenon in our theories? The cold dampness cause the qi blockage or the deficiency of qi and blood. We also going to observe the skin color, such as this color is not very clear, but you can see the color is slightly bluish. That's the stagnation. That's also the bluish also can reflect the pain. So this patient also can present with pain. The other cause also can be the injury. And here you can see a cranny. A cranny is very similar to the crane, the animal. When you see the crane, you can see the joints is much bigger than the legs. Deformity of the lower limbs. So here you can just have a look, have a general understanding. When you see, you will recognize like X shape or O shape of the leg. Very varicose vein. That's the vein in the legs. You can see the bluish. There's the stagnation, the bluish, blood stagnation, the coldness, dampness. The patient also will tell you that they feel cold in the leg. Fingers and toes. Here we give you some of the images. The acropathy, the finger bigger on tip. This is the arthritis, gangrene. When you see gangrene, abnormal changes in the palms. This is mostly we're going to introduce one. If you see this kind of palms. Firstly, how we understand the color is red. So the red color is a kind of heat. Now you're going to think about what kind of a heat. What kind of heat you're going to combine with from the signs and symptoms from the inquiry and also from the tongue diagnosis, pulse diagnosis. Okay. Okay, so when we see the redness, we will think about the heat. This problem in general medicine also due to the patient with the dysfunction of the liver. Normal change in fingernails. In fingernails, we're not going to focus a lot. This is the fungus inflammation. When you see the top picture, these kids, Do you see the white lines in the nails? That can indicate the malnourishment of the kids. So the the digestive function is not well in this kids. That's something you can see from the fingernails. There's also the other type of slide. You can put, as you can see here, you can put the water there. It looks like a spoon. And explanation, you can go through your textbooks, and we're not going to introduce a lot here. The reason is because most of these conditions we don't treat with acupuncture. And that's why observation of the movement, flexibilities of the limbs. So this is the impairments of the movements of extremities. It can be the wind cords attack the meridian or the squealer of the stroke due to wind phlegm. So when we see the stroke patient, when you see the patient with impairments of the extremities movement, how do we treat them? You're going to think about the cause behind the impairment. The wind phlegm, you're going to clear the wind phlegm. Stasis, we're going to clear the stasis. Or if due to deficiency, you're going to improve the qi and blood in the body. So that's how we're going to explain and how we treat the cause from here. The structure of the hands and feet. The contributing factors can be the coldness, deficiency of qi and blood. So for these symptoms, for this session, you will have a general understanding, just general, just a general introduction of these symptoms. And in the therapeutics, when we face these symptoms, we will talk more. That's in the diagnosis, in the therapeutics. That's how we gather all these different symptoms put together. As you can see here, when we introduce one by one, and some patient may, and most of the patient actually can present with the other symptoms together. So in the therapeutics, we're going to gather different symptoms and we put together to see what's the syndrome. Next one is inspection of the external genitalia, urethra, and anus. For this session, we're also not going to focus a lot. We just give you some of the examples. And mostly here, in acupuncture theories, we focus on the liver meridian. The reason is because of the liver meridian goes all the way up to the legs and the external genitalia area and to the chest area. If you don't remember, you can go back to the basic theories when we talk about the meridians. You will see why we focus on the liver and kidney. The first one, swollen scrotum or vulva in female. So this is very similar to the enlargement of the other area. So the enlargement, you think about the stagnation. The enlargement of especially for this area, it also can be the hernia. It can be the prosthesis. So when you see the enlargement of certain parts of the body, you need to think about what's the cause. It can be the prosthesis, it can be the water retention. It also can be the heat. The reason is because if the heat in the limited area, if you increase the heat, you're going to increase the pressure of the wall. And if the wall is weak, you're going to enlarge the space. And that's how, and if due to heat, the patient can present with other symptoms such as the wound feeling or pain, a warm sensation or pain. That's why it says a warm sensation and pain indicates the downward flow of damp heat. The heat is from the warm sensation. So it can be either cold dampness or qi deficiency. As you can see, the contributing factors includes many different pathogens. And these are possible pathogens. When you diagnose, we're going to use other symptoms. Itching, sweating. This area, the itching, sweating, the sweating is the body fluids coming out. The body fluids coming out of the certain areas. That's because of the qi lose the defining function. So that's excess sweating. Or it also can be the sweating also can be the heat, damp heat force the body fluid to come out of the body. This is very similar again when we talk about the theory. That's when you cook your food at home, when the heat reach certain degree, it become boiling. You can see the heat is coming, the steam is coming out of the pot. That's sweating. That's the heat in the body. So in the treatment, we also going to reduce the damp heat according to the causes. Prolapse uterus. This is referred to as in the picture you can see the uterus coming out from the vagina. This results of spleen qi deficiency, spleen qi sinking. Even for childbirth, after childbirth, how can we help this situation? We're also going to focus on to recover the spleen qi function. This is because of the dislocation of internal organs. The dislocation of the internal organs, then we will blend the spleen qi, because the spleen qi governs the rise of the career. You should still remember the theories. If you don't remember these, if you're confused what I was talking about, you can go back to the basic theory. The next one, like something in these images, for these problems, if a patient comes to you with these problems, we don't really treat them with acupuncture. So in acupuncture practice, we don't really see these kinds of patients. So you can just have a look and you will know this is abnormal, but we don't treat with acupuncture. Abnormal changes in the posterior orifice. In this session, we also don't use a lot in acupuncture. So you can go through by yourself. And there's one I want to mention is the hemorrhoids. Hemorrhoids we also don't treat with acupuncture, but this is very common just in general, it's quite common. So the hemorrhoid is the vein problem, the blood stasis, or outside here. So it depends on this line. It's if above, because internal, is below, because external. If happens in between, mix. The contributing factors of the hemorrhoids can be the damp heat. So if we don't really use acupuncture to treat, but we can help the patient to prevent. How to prevent the attack of hemorrhoid is to also to reduce the damp heat in all aspects, such as from the lifestyle, from the diet. As you can see here, these are the hemorrhoids. This one is the severe hemorrhoids, mixed hemorrhoids with inflammation. So if a patient presents with this, the patient will be very will be very painful. The rectal prolapse, this is very similar to the uterus relapse. That's also because of the qi deficiency, a result of a spleen qi sinking. So for those kinds of tumors, we also focus on the spleen qi. For the spleen qi, we can use either herbal medicine or moxibustion we're going to introduce in future. For moxibustion, we can treat the prolapse of the uterus and the rectal prolapse. These are some of the inspections that we are going to introduce in this video. In the next video, we're going to show you some pictures of the skin dysfunction, skin disorder. As you can see from this session, especially for this previous video, this video, and the next video, some of the information we go through very quick. The reason is because this for acupuncture practice, we don't see this kind of patient a lot. And also from here, you will see for Chinese medicine treatment, the herbal medicine, the acupuncture, they have their indications in which situation, which disorder, herbal medicine is better, in which disorder, which problem, acupuncture is better, or in which situation, both of them can be applied. So as we study more and more, you will understand more about this. So we don't use acupuncture for everything. Just keep in mind. Okay, thank you guys.